Good afternoon, and welcome to another installment of Direct with the Director. I am Greg Foster, Director of Emergency Management for Nassau County, Florida. This format gives us an opportunity to have a less formal discussion about the current issues in COVID-19 and the current status. It is as important now as it's ever been to use preventative actions. We are currently going through a surge in the numbers in Nassau County, and we are on the cusp of another holiday, which people are going to gather. So it's very important to remember to wear your mask, socially distance, and use proper hygiene to help us combat this current surge. There is a vaccine on the horizon. However, it is very important to stick with what is helping keep the surge down using the preventative actions that have been advised by the Florida Department of Health and the Center for Disease Control. Along with me here today is Dave Richardson, my PIO here at the Emergency Operations Center, and I think he's got a couple of questions that we can discuss. Dave.
Always have a couple of questions, don't we, Director? You mentioned vaccines, so I want to talk about vaccines. But before we do that, you mentioned the surge, so the number of cases and the percentage of positives based upon the test results is remaining consistent in Nassau County, and it's higher today than it has been in the last few days. So it's not going away.
Sure.
We have to continue, as you have pointed out, following the CDC guidelines, the three things. All right, so the other subject is vaccines, and we're getting questions. There's been a lot of news reporting on the vaccines, and so the question will become, we're in Nassau County, and this is not a major metropolitan area. We don't have 1 million people in one city here as some of the other cities across the state of Florida do. So there are a number of questions. Let's start with when are we going to see vaccines coming to Nassau County?
Sure. As far as we've been advised so far, we have had the first shipment of vaccines into our county. There is a plan that is put out by the CDC and the Health and Human Services Department on the federal level of how those vaccines are going to be disseminated, who are going to be the target groups of those vaccines. This is phase 1A of the vaccine process. So it is for healthcare workers in the hospitals and the ALF settings and the residents of assisted living centers.
ALS, for people who don't know what that
assisted
means.
Living centers,
Okay.
and also skilled nursing centers, long-term residential living for people that need assistance. So this first set is for them because they are some of the most at risk. Obviously, healthcare professionals because they come in contact with everybody who's sick with any disease, but specifically with COVID. And then the people that are in those facilities, special needs facilities or skilled nursing facilities, sometimes have the pre-existing conditions and the age that puts them at a risk for the disease. We're anticipating in the next several weeks that phase 1B will come into effect, which will be the first responders who come in contact with sick people all the time, which is your firefighters, EMTs, paramedics, and then some more of the population that are the at-risk population. Then there will be another phase, and we're anticipating that'll be a couple of weeks after that phase, that will be for law enforcement officers, second responders, and then some more segments of the population. And then it will move into the general population sometime in the next few months.
All right, so we're talking about a process that's going to take between now and late spring, early summer before
Sure.
the general public is seeing the vaccines.
Sure.
All right, so one of the other questions we're getting is, all right, where do I get the vaccine?
And that's a really good question. It's been a while since we've been through this, H1N1 being the last one, which was 11 years ago, a little bit more than 11 years ago. Again, federal agencies that are in charge of this, and then the state agencies, be it Florida Department of Health in the state of Florida, are in charge of how that's going to go. And then your local Florida Department of Health in Nassau. The First few phases are obviously going to be closed phases where specific groups of people are going to be vaccinated. Again, the ones I just ran down. When we move into the general population, it's going to be a mix of targeted, what's called a closed pod, and then in there will also be open pods where there will be an opportunity for you to come get the vaccine. Also, there's going to be vaccine that's going to be available at doctors' offices, remain available at the hospitals, urgent care centers. There's going to be vaccine as the quantity that's available increases. The quantity that's going to be in Nassau County is going to increase also. So there's going to be multiple opportunities for the general public to get vaccinated.
Right, and so the Florida Department of Health, Nassau County will share information about when vaccines for the general public will be available, where you can go get a shot, right?
Sure. Yep.
All right, so let's also talk about vaccines. A lot of people have concerns about, okay, these vaccines were developed very rapidly compared to other vaccines, flu vaccines, everything else that we take shots for. So some people are concerned about its safety.
Sure.
Is it safe to take these vaccines, and why?
And I understand that concern. Obviously, the fastest vaccine, as far as I know, looking back through records, is 4 years that it took to make a vaccine. This was 10 months, 9 months, somewhere in that general range. So the question is understandable. What the people of Nassau County need to remember is that the Federal Food and Drug Administration is in charge of making sure that this is safe and that it can be used in an emergency protocol like it's being approved, the Pfizer and hopefully soon the Moderna, vaccine. They didn't short step their process. It sped up, but the process was still there. I have the utmost confidence, especially after talking to the doctors and the health department and then doing my own research. I'm confident that this is a safe vaccine. Obviously, there are side effects to anything that's given, and they've come out with some possible side effects on this, but they're not terrible side effects.
And they're far and few between if there is
absolutely
adverse.
Absolutely. It's a small percentage of the test subjects have had the side effects.
And the technology used to develop these particular vaccines was different.
It was different. The way that they developed these vaccines is a lot different from how previous vaccines were made. And I'm not a scientist or a doctor, so I'm not going to try to get into the particulars. But if you've been watching the news and listening to the reports coming out, they've been talking about the fact that they were able to make this vaccine so quickly because they used new technology. Again, the last time that we had a mass vaccination of the public in Nassau County was 11 years ago with H1N1. Technology's come a long way, be it computer, medical, pharmaceutical technology's come a long way, and they've been able to use those advancements to make this quicker.
Okay, and so last question, so how will we inform people when the vaccine's going to be available in these different phases?
Much like what we've been doing with the testing from the Department of Health, the Department of Health is going to let us know because they're the lead agency in a public health emergency. They're going to advise us in emergency management where those facilities are going to be, what status we're at, what level of the warp speed program we're in, and we'll be pushing that out from the Emergency Operations Center. So when there is an open pod that's made available where people are going to be able to drive up or walk up and get the vaccine, we'll be giving them plenty of notice on that.
Okay. And we're going to do this again next week.
We are.
So we're going to be very consistent about doing this every Thursday at 4:30. And so we'll do that again next Thursday, right?
Absolutely.
Thank you.
Thank you.